So my name is Andreas Goette. I'm professor of medicine at the St. Vincenz Hospital in Paderborn, Germany, and I'm head of the Department of Cardiology and Intensive Care Unit in Paderborn. I'm also member of the German EAST-AFNET located in Münster, where we actually conducted the trial, which I present during this AHA meeting. What we need to discuss and what we need to figure out is how early do we need to start therapy? And this is the main concept of electrical remodeling, that we know that patients who suffer from the very first episode of atrial fibrillation, they suffer from a process that atrial fibrillation begets atrial fibrillation. So it's very interesting to see if a rhythm control therapy where we can establish sinus rhythm really is related to a better outcome. And initially, that was the strategy why we developed the EAST-AFNET 4 trial. And Paulus Kirchhoff published these data, the original data from the main trial 2 years ago in the New England Journal. And we found that it's very important to start therapy early on, to be as aggressive as needed to keep the patient in sinus rhythm. So for that reason, we need to know if this strategy is necessary for all patients with atrial fibrillation. And this is the main aspect of our presentation during this AHA meeting. So what we did was, this was a multi-center randomized trial where we assessed differences in rhythm control strategies. So we compared early rhythm control using antiarrhythmic drugs and a catheter ablation in one cohort versus usual care. And usual care in this cohort was actually done by rate control, that we really used medication like beta blockers or verapamil or so for just rate control. So it's really a rhythm control versus rate control study.